And joined by two of the country's top doctors as we look at this second wave of COVID, Dr. Randeep Gulleria, the All India Institute of Medical Sciences Director, and Dr. Hemant Thacker, Mumbai's leading consultant physician. Appreciate both of you joining us. Dr. Gulleria, to you first. Do you see this as a second wave or a third wave in a form in North India, not just Delhi but across the northern states, and is it linked directly to the onset of winter and the festive season?
The wave, you could call it the second or third wave, but there's definitely been a spike in the number of cases, and it's possibly related to three factors. One is, of course, the festive season, which had just got over, and we saw that there was really very little COVID appropriate behavior, and we had crowds, and we know that if you have crowds like this and you have people who are not wearing masks or not having physical distancing, any of these crowded areas can become a super spreading events, and that can lead to a spike in number of cases. Second is, we know that respiratory viruses tend to increase, or the cases tend to increase during the winter months, and that is what we are seeing in North India, and this happens every year when we look at data from H1N1 or swine flu, that it tends to peak during this time of the year. And as has already been pointed out, that pollution also tends to play a role, and the combination of air pollution, the fall in temperature, and the lack of COVID appropriate behavior over the last few days has led to this spike in cases as far as North and Central India is concerned.
Right. So would you say therefore it's much more localized to these states? It's not an all India phenomenon? Could I say that pretty safely?
So if we were to call it an all India phenomenon, then we would see a big spike in the number of cases that we are seeing on a national basis. The number of cases at a national level have actually continued to be around less than 50,000 per day. That level has been consistent, and that hasn't shown a spike. What we're seeing is an increase in certain localized areas, especially cities where there has been a lot of crowding because of the festive season, and therefore I think this does continue to be, as of now, relatively more in certain states rather than being all over the country.
You know, Dr. Thacker, you're there in Bombay. Are we seeing a major distinction, therefore, between, let's say, a Mumbai and a Delhi? That where Mumbai, there seems to be, at least in total number of cases and even in positivity rate, some kind of a control coming in. Delhi and other parts of North India are experiencing this spike. Are you also suggesting perhaps that this is much more localized now? It's no longer a pan-India phenomenon?
So I like the adjective that you used at first. To me, it appears like a North Indian wave, and while in Mumbai we are holding our breaths and we are sitting at the cusp, because today is about just a week since the Diwali celebrations have completed. I want to wait for the next 5-6 days, but I can certainly say in the last 3 days there has been a small up in the number of cases. I'm not trying to scare anybody, but if we had nothing during the run-up to Diwali, we have about a 10 to 12% spike. Of course, we have beds available and everything is there. But you know the old Indian saying that if you do what you did, you will get what you got. Or for the North Indians, I will say, Jaisi karni, vaisi bharni. If you don't have social distancing and the markets are blaring with shopping, and there's celebration, meeting, hugging, greeting, everything going on, they have to pay the price. And I'm happy that the Maharashtra government is trying to Lakshman Rekha the city and the state, because up to now Mumbai and Maharashtra in the first and second wave was the epicenter, and we do not want our state to fall into the same category. Having said that, we are still one India, and it will take only 2 flights and 2 super spreaders to bring everything all over the country. So I am again holding my breath and folding my hands to say that let's keep the country free, let's exercise discipline. The rule of the law has to prevail. Whatever you find them, you have to find them immediately, and you have to exercise discipline, without which we are in trouble.